We are here today to discuss a very important medical conundrum and what we as healthcare providers must do about it. The CDC estimates there are over 2 million antibiotic-resistant infections a year, and those infections have cold, hard consequences, including 23,000 deaths per year. What's the cause? The short answer? Overprescribing of antibiotics. Bacteria that are exposed to antibiotics are changing, evolving, figuring out how to survive, and they are sharing that information with their descendants and their friends. That means resistant strains of bacteria quickly appear upon exposure to new classes of antibiotics. Antibiotics are the only medications where use in one patient can impact the future effectiveness of the antibiotic in others. So we must choose wisely, judiciously, using antibiotics only when necessary. It's easy to prescribe antibiotics, and our patients seem to want them. Antibiotics are for bacterial infections, not for viruses. They won't work on viruses like the common cold. Studies have shown that 30 to 50% of the antibiotics we write are unnecessary. This overuse of antibiotics is leading to increasingly drug-resistant bacteria in our patients. We are overprescribing ourselves into an antibiotic-resistant pandemic. So what is the solution? Anyone? We must practice better antibiotic stewardship today, every day, with vigilance. Be the provider who tells the parent of a 4-year-old with a stomach virus that they can go home without an antibiotic, but that you'd be happy to prescribe popsicles on demand. Be the provider who tells a daughter and her elderly father an antibiotic will not help his seasonal allergies, but that you have a better idea. Be the provider who explains why. Do your homework. Stay up to date with clinical guidelines for common infections. Be familiar with local antibacterial resistance patterns. Be an educator. Be part of the solution. Help others understand how they can be part of the solution. We can all do our part. No one can do it alone.